Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, correct codes, and more. Let's get started. Let's review the CPT codes used to report this service. 73060, radiologic examination, humerus, minimum of 2 views. This CPT code is used when the X-ray includes 2 or more views of the humerus, the upper arm bone, often taken to evaluate fractures, postoperative changes, or degenerative changes from the shoulder to the elbow. Radiographs of the humerus may include standard and trauma-focused views, depending on the patient's condition and positioning ability. Standard views, humerus AP view, evaluates the humerus from the shoulder to the elbow. Humerus lateral view offers a lateral profile of the humerus. A true lateral of the elbow may also be included. Trauma view, humerus transthoracic lateral view, used in trauma scenarios where the arm cannot be repositioned due to pain or fracture. Understanding the use and purpose of each view ensures proper CPT selection. Report example. Order exam, humerus 2 views left. Header, AP and lateral radiographs of the left humerus. Clinical history, left side follow-up post-op to check range of motion. Comparison, 10/25/2022 findings. Interval placement of a plate and screw fixation hardware crossing the distal humerus fracture. Improved alignment. Post-surgical changes of subcutaneous emphysema, demineralization. Impression. Post-surgical changes of distal humerus fracture fixation with improved alignment, now anatomic. Let's look at the views. AP and lateral views of the humerus were obtained. That's a total of 2 views. This qualifies for CPT code 73060, radiologic examination humerus, minimum of 2 views. Now, let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state, the patient is undergoing postoperative imaging following internal fixation of a distal humerus fracture. The exam is performed to evaluate alignment and the status of the hardware. No new complications are seen. In this example, the imaging appears to be performed as an outpatient follow-up postoperatively with no procedure performed during the encounter. However, it is essential that the coder reviews the chart documentation or consults with the ordering provider to confirm whether the imaging is part of an active treatment plan, such as inpatient surgical care or a routine outpatient follow-up. The most appropriate ICD-10-CM codes are S42.402D, unspecified fracture of lower end of left humerus, subsequent encounter for closed fracture with routine healing. The radiology report confirms this is follow-up imaging for a healing distal humerus fracture with no complications, qualifying for D. And Z98.1, arthrodesis status. This code is used to reflect the presence of internal fixation hardware, plate, and screws without a joint replacement. Correct codes for this report are 73060, left radiologic examination, humerus, minimum of 2 views, S42.402D, unspecified fracture of lower end of left humerus, subsequent encounter for closed fracture with routine healing, and Z98.1, arthrodesis status. Thanks for watching. Be sure to check the links in the description for helpful resources, and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.